So for this exercise, we're asking your stroke survivor again to sit with the mirror placed so that their affected arm and hand can be seen in the mirror. And they're sitting on a comfortable chair with a small table in front of them. And the exercise this time is to practice bending the wrist backwards and bending the wrist forwards, or what we call extension of the wrist, where we bend it backwards, and flexion of the wrist, where we bend it forwards. So ask your stroke survivor, and this is very, very important, to fully benefit from mirror therapy, they must focus on the reflection in the mirror. They must focus on the reflection and visualize that the reflection in the mirror is their affected side. So ask your stroke survivor to bend their non-affected wrist backwards and hold that position for 3 seconds. So 1001, 1002, 1003, and then bend the wrist forwards as much as possible and hold that position for 1001, 1002, 1003. We'll repeat the backwards and hold for 1001, 1002, 1003, and forwards for 1001, 1002, 1003. And then finally backwards, and also try to bring the fingers and thumb backwards as well. 1001, 1002, 1003, and then forwards into a fist and wrist forwards for 1001, 1002, 1003. And this exercise can be repeated a number of sets based on the prescription that's been given to you.